Next is preparing and administering oral medication. So first, I'm going to check the accuracy and completeness of each medicine ticket with doctor's order sheet. So check the patient's name, medication, dosage, and route of the time of administration. So it is to ensure that the patient received the correct medication. Eligible marks are source of medication error. Second is to review the pertinent information related to medication, action, purpose, normal dose, and route of side effects and nurse consideration. Is to allow us to anticipate the effects of the drug and observe the patient's response. Next is to assess for any contradictions to patient receiving our medication. So it is alteration can interfere with medication distribution, absorption, and excretion. So next is to prepare medication and perform hand hygiene. It is to reduce transfer of microorganisms. First is to arrange a medication cup in medication preparation area. So I've already arranged it, so it is organized of equipment, save time and medical error. So next is to prepare medication for one patient at a time. So follow the 10 rights of medication administration. So it is to prevent the distraction and limits preparation error. So next is to check correct medication from stock supply. So reading labels and comparing them with transcribe or order reduce error. So I'm going to read the labels. So next is to check the expiration date on each medication one at a time. So medication past their expiration date may lose strength and be inactive or harm the patient. I'm going to observe the medication. So next is to check or calculate medication dose. Necessary double check the calculation, double checking the reduce or error. So prepare solid from oral medication. So it is to avoid contamination of waste medication. It is to prepare tablet or capsules from floor stock bottle. Pour required number of or little cup and transfer medication to medication cup. Do not touch the medication with fingers. Return the extra tablets to capsule. So I'm going to get the extra cup. So to prepare the unit dose tablets, capsule, place the package table or capsule directly into the medicine cup. So do not remove the wrapper. So the wrapper maintains cleanliness and allow you to identify medication name and dose patient beside. So next is prepare liquid. So gently shake the container. Shaking container ensure the medication to mix before administration. So remove the cup from the container and place the cup upside down to hold the multi-dose bottle with a label against the palm of the hand while pouring. So it is to maintain cleanliness and ensure the spilled liquid dose does not soil the label. So place the medication cup at the eye level on a hard surface. Fill to desired level on a scale. Make sure that the scale is even with fluid level at its surface or base of the meniscus or not edges. So it is to ensure the accuracy of measurement. So next is to discard any excess liquid into sink. So prevent contamination of contents of bottles. So wipe the mouth of the medication bottle with a paper towel or tissue before covering with bottle cap. So it is to prevent bottle cap from sticking. The next is to return the stock container to the shelf or drawer and read the label again. So reading the label of the medication in multi-dose container reduces the administration error. So do not leave the medication unattended. So nurse is responsible for safekeeping of drugs. So before going to the patient's room, compare the patient's name and name of medication on label of prepared drugs with a medicine ticket. So I'm going. So reading the labels the second time reduce errors. So take medication to patient at the correct time. So it is to ensure intended therapeutic effects and complies with professional standards. So next is to ask the patient his or her name or identify the patient using the tag. Compare with the information on the patient's medicine ticket. So it is to ensure the correct patient. So what's your name, ma'am? So explain the purpose of each medication, its action, and possible side effects to the patient. So it is to allow the patient to express concerns regarding possible non-adherence to therapy and possible identifies potential errors in medication orders. So perform necessary pre-administration assessment. So it is to determine whether specific administration should be withheld at the time. So next is help the patient to sitting or forward position. Use side lying position if sitting is contradicting. Have the patient stay in this position for 30 minutes after administration. So it is to prevent aspiration from during swallowing. Can you sit properly, ma'am? So administer medication. Allow the patient to hold the solid medication in hand or cup before placing in the mouth. So patient become unfamiliar with the medication by seeing each drugs. So can you so can you drink this one? So offer water or juice to help the patient swallow or give full of glass if contradicted. So choice of fluid can be approved fluid intake. So stay until the patient completely takes all the medication by their prescribed route and ask the patient to open their mouth uncertain whether medication was swallowed. So did you swallow it all, mom? So to ensure the patient receive order dosage, to help the patient to return a comfortable position and to maintain patient's comfort. Can you return back to your position? So next is to perform hand hygiene to reduce transmission of organisms. So next is evaluate patient response to medication. So evaluate therapeutic benefits of medication and detects onset of side effects or allergic reaction. So lastly is to chart medication dose, route, and time and date given on the patient's medication record. So immediately after administering, it is to ensure that you have given the patient the right medication.